Atrial fibrillation, or AFib, is the most common type of irregular heart rhythm, and it affects millions of Americans. While it can sometimes feel harmless, AFib can significantly increase the risk of stroke and other serious complications if left untreated. And today we're joined by Dr. Wenn. He's a board-certified and fellowship-trained cardiologist with Trinity Health to talk about what AFib is and how to recognize its symptoms and why early diagnosis and treatment are so important. Good morning, doctor.
Good morning. How are you?
I'm well. Let's start immediately with what AFib is. How do you diagnose that?
So AFib is an electrical problem where instead of firing in synchrony with the two chambers of your heart, the upper chamber is actually firing more rapidly. Okay, and what that unfortunately leads to is less contraction of that chamber, so you get pooling of blood, which can be prone to forming clots.
Okay, and that would be a major concern, those clots.
Yes, because those clots can travel anywhere to the body, but most concerning is if they travel to the brain and cause a stroke.
Okay, how would one know that they may have AFib?
So there are a lot of signs and symptoms. Irregular heartbeat, palpitations, racing of your heart. Sometimes you can feel dizzy, short of breath, have chest pain, and some patients can even pass out. But unfortunately, you can have AFib without even knowing that you're having it without any symptoms. And that's only diagnosed either through an EKG or a physical exam with your physician.
And I'm assuming that, as with others, early detection is super important.
Yes, sir. Because if you leave AFib untreated and it's going fast, eventually it can actually wear down the heart muscle and the heart function can be reduced.
Now, the good news is Trinity Health, you're part of a cardiovascular network in West Michigan that is aimed right at this problem.
Absolutely. So we have, different facilities in different parts of West Michigan so that everybody has, access to care. We're also affiliated with University Health West as well. So we have multiple Trinity locations as well as the U of M Health West.
For someone who may be watching this right now and maybe had a race or maybe had a dizzy spell, how does one, what's the first step if someone suspects that they might have AFib?
First step would be to see your primary doc and get an EKG performed. Unfortunately, because AFib can come and go, you don't always catch it with an EKG. So usually you would get prescribed a heart monitor to wear at home over the course of 1, 2, sometimes up to 30 days so you can catch that.
Absolutely. So again, be persistent if you have these symptoms because, as doctor says, it can come and go. And of course, being part of this cancer or being part of this network that you have here in town makes it a lot easier right there. You can reach out to your primary care provider and discuss a referral to an atrial fibrillation specialist. Or you can just visit trinityhealthmi.org/AFib if you'd like to learn more. Thank you for the time this morning, doctor.
Yes, sir. Thank you for having me.